American teens are showing some signs of improvement when it comes to mental health. This is some good news. The CDC reporting adolescents 12 to 17 made fewer emergency department visits for mental health conditions in the fall of 2022 compared to the year before. That was COVID-19, of course. The pandemic was in full swing. The CDC links the loosening of pandemic restrictions to a decline in emergency visits. Despite the improvement, though, the agency also reports that youth mental health conditions, it's a public health problem, calling it an ongoing crisis. And I don't think you need a report to tell you that it's challenging for teens, the pandemic was, and it's been challenging for adults. Here to talk more about our teens, Dr. Mitch Prinstein, Chief Science Officer at the American Psychological Association. Doctor, appreciate your time on this. It is so important. I'm curious, are teens open to talking about their mental health now more than they have been in the past? What are you seeing?
I think so. I think teens are more comfortable talking about mental health than a lot of the adults are. So we really need to follow in their footsteps and talking about this openly.
So there are several layers to this, and I think one being the pandemic, right? The isolation and the challenges that the pandemic presented. But does this go back further than that? Or is it starting to build some of the concerns mental health-wise that teens were dealing with?
Yeah, I think the pandemic really exacerbated what we were seeing for many, many years beforehand. I mean, sadly, we've been neglecting mental health and kids' mental health in particular for many, many years. We barely do any prevention. We don't pay as much for mental health as we do physical health care. So this has been a problem for a very, very long time.
Is it an urgent issue? Is it an epidemic, as some have characterized it?
I think so. I mean, I think we're certainly not out of the woods yet. What happens with kids is that when they have a disruption or something that's harming them, that maybe impairs them for about 6 months or so, that means they've missed like a school year, a good chunk of it. They've, missed relationships or opportunities to develop skills. And that sets them off on a whole trajectory. So when it comes to kids, the effects of stress can take years for us to fully see.
And a lot of times, even as adults, we do this. We'll shrug it off. We'll say, oh, it'll get better in a couple of weeks. Things will change. You can kind of talk yourself out of having a mental health issue or a moment. Do we do the same with teens? Like, it's stress, it's anxiety, it's normal. But after you take that test, after you go to that game, it'll get better.
I think it is really hard for us to acknowledge just how hard it is for teens right now. And it's probably protective to us to think that it's, no big deal. They'll get through it, because a lot of us feel pretty helpless on how to help so many kids experiencing so much distress. But it really is important that we don't think of this as a phase or just a minor issue that's going to pass. These are a lot of kids experiencing a lot of stress and having a lot of symptoms as a result.
So how do you convince a teen who you notice, it's your kid, and you just think this isn't like them? I'm noticing all the signs. They're isolating, they're disengaging in activities they used to like, but I think they need help. They're saying they don't. How do you navigate that, and what's the first step?
I think the first thing we want to do is really normalize this for teens and say, a lot of people who have experienced stress are likely to have these kinds of feelings or notice these kinds of changes in their behaviors. So if you're feeling that way, it doesn't make you different or kind of in trouble, but it's a normal kind of thing to experience. And then kind of talking with them about the way that we would address a physical health problem is to ask for help or treatment. So of course we should do the same thing when it comes to our emotional health.
And what's the role in social media, in screen time, in all of this, and how has that changed?
Well, social media can really help in a lot of ways, but the programs might be designed in ways that push us towards the worst parts of it, just to count how many likes you've gotten or how many followers you have. And that's not developing or cultivating kind of emotionally supportive relationships in the way that we know really helps. So it's really important for kids and parents to think about, are you getting happiness from your screen time, and are you using it about as much as you want? Or do you feel like you've gotten sucked into doing it more than you want? And you find yourself feeling worse when you're done more than better. If those are the cases, then you really need to start thinking carefully about how to use your screens differently.
And some research in the CDC indicates that girls are impacted more and challenged more when it comes to mental health than boys. Why is that?
Well, when we're talking about subjective distress, like feeling anxious or lonely or depressed, we've always seen that girls are more likely to report those kinds of symptoms. We also see that girls are more likely to attempt suicide, although boys are more likely to die by suicide because they.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.